Governor Mutua, 3.2 billion construction of medical facilities, including 50 new level 3 hospitals. Do we need to construct more hospitals or just equip the ones that we have?
Well, I think it's something. Let me start by saying that, first of all, the disbursements to counties are late, and they're always given us to us late. In Machakos, I'm facing a form of, it's not a crisis, we've taken care of it, but it's a problem. Yeah. Because there was a time there where we had no resources coming in healthcare, that we could not provide services. We have doctors who are working, we have nurses, we have different people, but we have to send people out to get medicine. We have to tell people come with a glove. We have to tell people come with this. It's a big shame for a government to be crippled in such a way that where I have heavily invested in Machakos, that I cannot provide a service because of late disbursement of money from the national government. And I think it is because we have always said as Council of Governors, there is total disrespect in the minds of some people when it comes to funding county governments. Yeah. Without knowing that county governments are the ones that are touching Mwananchi, who is a voter, right on the ground. So it is a big problem. So I do agree with Governor Gachagua there that yes, Honorable Gachagua, that yes, there's that challenge of medicines, that challenge of gloves. I've seen it in Machakos, and I've told my people, be patient. I've been negotiating with KEMSA to give me drugs when we don't have money to pay them at this time, when we owe them. And Machakos is better than many other counties. Other counties are suffering. At least in Machakos, I've put buffers. They have ambulances, I have all these things, but it's still a problem. Yeah. Now, when it comes to the thinking of the healthcare, this is, it's what you call, it's a 50-50. It's a win-win-lose situation here. You see, the WHO, and I see where the president is coming from. Yeah. The WHO has really put standards. And you remember we signed also for the UNDP program of development. And it says that you need to have medical facilities accessible to people within 5 kilometers, generally around the country, because this is pushing the fact that we cannot afford curative healthcare. You know, people wait until they are sick. Mtu amekuwa mgonjwa ndio anapelekwa hospitali. Yeah. You know, I was talking to a gentleman called Mutunga that you might know, who was telling me that he was away last week because he was dealing with a sick person who had to be taken to hospital at that last stages of sickness. Yeah. We find that many diseases can be taken care of at the lower levels, in level 1, level 2, level 3, and you are treated so that you don't have to go to the referral hospitals where it's more expensive to take care of you. And that is why now the system we've set up of CHVs, community health volunteers, is working very well. You take care of that problem down there. With the proper funding, it works very well. Yeah. Now, why is Uhuru putting money in level 3s? I believe it's not just level 3s and level 2s. I think it's keeping to that, because prevention works. Let me give you an example. After the problem we had when Mwai Kibaki lost the referendum of 2005, the banana orange referendum, he dissolved his government. When government formation came in, Mwai Kibaki, in his wisdom, decided to split the Ministry of Health into two. And so we had the Ministry of basically preventive health and curative health. Preventive health had Beth Mugo, Mheshimiwa Beth Mugo as a minister, and then we had Anyang' Nyong'o, Mheshimiwa Anyang' Nyong'o as a curative. During that time, because of that concentration towards prevention, healthcare, you find that we are able now to initiate a program to roll back malaria. Yeah. Malaria was killing Kenyans. Look at malaria. Machakos today is free from malaria. Nairobi is free from malaria. Many places are free from malaria. Mombasa, it has come down the coast province to now 3 or even 2%. Yeah. And we had great people working in the Ministry of Health, you know, in directors, everything, concentrating in prevention so that you don't have to cure. Yeah. And you see, that is maybe the thinking that is there, that let's spend little money, making sure that people don't get very sick, so we spend less in curative. So we can have things that now, for example, in my Machakos Cancer Center, we're treating Machakos. Imagine now if we caught these cancer problems at the lower level, we're able to treat them earlier, not when people get sick and get referred to the level 4 and level 5 hospitals at the far end. Right. So it is a win-win. Yeah. I see the challenges of equipping, but also if there's enough money coming in and there's money to take care of these facilities, then we'll be a healthier nation at the end of the day.
Okay.
We need these facilities, and I believe the money is not just about construction of the facilities.
Yeah.
It may be construction and equipping of these health facilities. They are called health centers,
yeah.
level 3, and they work.
Okay.
They work miracles. That means that you don't have to move from your community to get a minor operation. You don't have to move from your community to give birth, to be hospitalized, to be treated, you know, without having to go outside. So it cuts down your cost and it treats you.